Welcome back to McLaren-Port Huron's Today's Health, and we're talking with OBGYN Dr. Stacy Tremp, and in this segment we're going to talk about uterine fibroids. What is the uterine fibroid?
So uterine fibroids are very common. I see them quite frequently in patients, and they can occur during childbearing years. So young patients can have fibroids all the way up until we're perimenopausal, right before we stop having our cycles, and even they can have fibroids. The cause of fibroids is pretty unknown. We don't know why people get fibroids or have fibroids. Fibroids are thought of as benign, non-cancerous, smooth muscle tumors. And you can see on the picture, they can form throughout the uterus at any spot. Sometimes they can jet into the cavity, that opening right there, or they can just be within the muscle itself of the uterus. Some actually form a stalk off of the top. If they came off the top of the uterus, there's a little stalk and they can come across, and that's called a pedunculated fibroid. But you can have them throughout the uterus. We don't know what causes them. They can be multiple sizes. They can be small, they can be very large, and they are benign. 99% of the time they're a benign tumor that causes heavy bleeding, and that's usually why people come in, and that's part of the workup for a patient who comes into the office with heavy menstrual bleeding is an ultrasound. An ultrasound is something that we can do to see if there are abnormalities within the uterus, or the ovaries, of course, to see if they do have uterine fibroids as a cause of their heavy menstrual bleeding.
What causes fibroids?
We don't know. Good question. We don't know what causes. They're just a smooth muscle tumor that's benign in nature majority of the time.
And who's most at risk to get fibroids?
Everyone. Everyone. I've seen them in all walks of life, I can say. We used to think that African American females were more predisposed to having fibroids, but I can tell you I've seen them in all walks of life, and every nationality of patients I've seen fibroids.
So you talked about a symptom of heavy bleeding. Are there other problems with fibroids?
Yeah, so if you can imagine, if you have the uterus, which can have its own weight, and then you add on a big fibroid, sometimes you can have pelvic pressure, sometimes you can have some low back pain in addition that's associated with these fibroids.
How do you diagnose them?
Usually an ultrasound or a physical exam. A good history and physical is always the start of any patient exam in my office. So talking to the patient, I always say, if you listen, they'll tell you what's wrong with you. Mm-hmm. So you do a good physical exam. You can feel some irregularities on their pelvic exam, or the uterus can feel kind of heavy. And then typically, if I have any questions about the pelvic exam, or I feel something irregular, what I'm going to do is order that transvaginal ultrasound. We do ultrasounds in the office, and that can show if there's fibroids within the uterus or even coming off of the uterus, like that pedunculated one we talked about.
How big can they grow? Very
large. I've seen some of them be very, very large. Basketball size, a little bit smaller. I mean, the largest one I've had is a lady had a uterus that was enlarged with fibroids way up to their xiphoid. So they can become very, very large, and the patient can actually even look pregnant at the time. And I think that a lot of ladies ignore their symptoms and think, I'm just gaining some weight, or my belly is just changing, I'm getting older. So I think it's important for women to kind of listen to their bodies. They will tell you if there's something changing.
Well, yeah, especially if it continues to grow like that. And I'm thinking, if you're pregnant and have a large fibroid, is that a problem?
It depends on where the location of the fibroid is, but the recommendations for pregnancy are to not necessarily remove the fibroid or perform a myomectomy prior to them getting pregnant. It's just to watch.
Watch and see. How do you treat fibroids in general?
So there is a couple of different options themselves. So we can take the fibroid out or do what's called a myomectomy. It's a surgical approach that we can make a small incision on the lining of the outside lining of the uterus and take that fibroid out and then repair that defect that was there from the fibroid. Those fibroids that kind of go into the endometrial cavity, so you can go in hysteroscopically and then shear them off as well. There's a medication that can cause fibroids to shrink called Lupron, but that's not necessarily a definitive. That's usually leading you to a surgical option.
So is there any other non-surgical treatments any other medication or anything
Not really.
else you can do?
Not really. There is uterine artery embolization that can be done, but a lot of patients opt out of that. So I've heard from my patients that it's painful. Some patients have it actually, even if they're within the muscle of the uterus, close to that lining on the inside of the uterus where you have your periods, they've passed fibroids vaginally, and that was very scary for them. So I have a lot of patients that opt out of uterine artery embolization.
Well, we're going to talk more about this, but first we're going to take a break.